Hi, my name is Dr. David Perrine, and today I wanted to talk to you about a condition called carpal tunnel syndrome, something that you may be familiar with or dealing with yourself. The carpal tunnel is made up of the wrist bones on the back side of the wrist and a special thick ligament that sort of like a piece of duct tape that's on the front side, and it creates a literal tunnel for the tendons of the hand to go through. Along with those tendons is a nerve called the median nerve, and that nerve innervates the thumb, the index finger, middle finger, and sometimes part of that ring finger. So some of the symptoms that you'll see with carpal tunnel: numbness in those areas. You'll see some weakness. People have a problem opening up a bottle or holding on to things, lifting things up, because it innervates the muscles of the thumb as well. So one of the tests that we'll do is to see how well someone can hold their thumb and pinky together, and a lot of times we'll see weakness on that front. So one of the treatments that's been really effective for me clinically over the years has been acupuncture. Acupuncture has been effective not just from a symptom standpoint, but really correcting some of the underlying issues. And by that, I mean what's happening within the brain. So with these nerve injuries, what we'll see occur is there gets to be this patterning within the brain, and even minor stimulation starts to provide us with those symptoms and trigger those complaints. What we've seen with acupuncture that is really cool is there's been some studies done with what's called functional MRI. So think of functional MRI as Doppler radar for the brain. So it will show activity. And what we noticed was there are areas of the brain that were really active with these patients with carpal tunnel. So they did a study, and they did this functional MRI before, and then they treated these patients with acupuncture. I think it was maybe 5 weeks or so, and the patients had definite subjective improvements, which meant they felt better. But what was really cool was they did the functional MRIs again and found that these patients had normalized brain function. So it wasn't just, we always thought it was an issue down in the wrist here, and that's where one of the common forms of treatment is surgery, where they literally would cut that big thick tendon. Now some of the procedures are a little less invasive, but it's still a surgical procedure, where if we can avoid that, I don't know about you, but I like the definition of minor surgery when a doctor tells you about a procedure. And the definition of minor surgery is surgery on somebody else. So there is no minor surgery to me. If we can avoid it, even better. So the acupuncture helps reestablish that normal nerve function, provides blood flow to that area. That's a real key in any healing process, and that's one of the benefits of acupuncture in any type of an injury, acute or chronic. We can stimulate that blood flow, which is going to improve our healing process. So what we want to do is not just treat the symptoms, but get to the cause. And for a lot of people, causes extended periods of time on the computer or on phones where we're in that flex position, so we're causing a lot of compression within those tissues. People using a computer and they have no arms on their chair, so there's no support, so they're just holding up, and now they're putting compression on that wrist and right on that carpal tunnel. So you want to make sure when you're on a computer that there's no pressure here. Any pressure should be on the elbow, but we want to watch the inside part of that elbow, because that's another nerve called the ulnar nerve, which goes down. That's where if you whack your funny bone, that's what you're going to feel. So you want to be supported right in your forearm, and you want to make sure that you take breaks every 15 minutes, literally. Now it's not a 5-minute break, but just sitting back, shaking those hands out a little bit. There's some really simple stretches, and I'm going to show you just a couple that you can do. To me, it's like brushing and flossing your teeth. Real simple, but they need to be done on a regular basis. So taking a break and then just bringing that wrist out and stretch and hold for 15, 20 seconds, even up to 30 seconds, and you should feel a nice stretch in that forearm. Another real simple stretch, I call it a prayer stretch. So we're going to put those hands together, we're going to bring those elbows up, and we're going to try to flex or extend those wrists as much as we can, because that's going to open up that carpal tunnel. So we're going to stretch as far as we can. Then we're going to use those fingers and we're going to push that opposite side. So it sort of forces it, it lets those tendons slide and move in there, but it really opens up that tunnel. So if you suffer from carpal tunnel, avoid the surgery at any cost. There's occasionally I have a patient that unfortunately there's just too much damage and they do need to have surgery, but that's pretty uncommon. Most people will respond very well to combinations of stretches, chiropractic care, acupuncture, but look for some conservative modalities that can really help not just treat symptoms, but help to fix and correct the underlying problems. Hope this helps. Look forward to some more videos, and if this is something that was helpful for you, make sure that you let other people know. We certainly appreciate it, and I look forward to talking to you soon.